Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist in Houston. I have been practicing cardiology for the past 40 years. The feature presentation here is blood pressure medications and their side effects. If you or one of your family members has a history of a high blood pressure and they are taking medications, you will be quite interested in learning a great deal about blood pressure medications, different groups of medications, how they work, and what are their side effects. So, this will be a lifelong lesson because hypertension is a lifelong disease. Hypertension progresses over a period of time, and there are excellent medications to control your blood pressure, reduce the risk of stroke, heart failure, and kidney problems and heart attacks. And the best way to do that is to have a good knowledge of the high blood pressure medications and particularly their side effects. So let us begin with the feature presentation. In this presentation, I'm going to be talking about primarily the medications that we use for treating high blood pressure. And there are different categories and they work at different levels to bring down the same point, that is to bring the systolic and the diastolic blood pressure. The normal systolic and diastolic blood pressure is 120 over 80 millimeters of mercury. Anytime your blood pressure goes over 140 over 90 millimeters of mercury, that should be a concern. And it should be a more concern if you have other added risk factors like high cholesterol, diabetes, and smoking. So let us focus on what are the things that you as a patient or have a family member who has hypertension, the things that you can learn from this presentation, which will make you an educated patient as far as hypertension is concerned, the risks of hypertension if it's left untreated, and the benefits of a hypertension treatment, along with the drugs that we are going to use and how they act and their side effects. We have a class of diuretics. These are the water pills. I'm going to explain a little more each one of these. Then we have the beta blockers. These are the medications which predominantly work on your heart. Then we have the ACE inhibitors, which work on the enzymes released by the kidney, the renin, which increases the level of angiotensin 1 and angiotensin 2, which increases the stiffness of the blood vessels, leading to the constriction of the arteries and arterioles, thus increasing your blood pressure. The purpose of the ACE and ARBs is to dilate these blood vessels, and that's a major effect of some of these drugs. Calcium channel blockers are a different kind of drugs. They also work on the blood vessels and they block the calcium channel so the blood vessels can dilate. Majority of the time the blood pressure is high because the blood vessels are kind of squeezed and they are constricted or restricted. That's why the blood pressure goes up. But if you can dilate these blood vessels and if you can make them more flexible, then we can automatically bring the blood pressure down. Then we have the alpha blockers, which are also again helping to dilate the blood vessels. Then we have a combination of alpha and beta blockers. Anyway, let's begin with each one of these items because these medications are quite commonly used in the treatment of hypertension depending upon the degree of hypertension, whether you have a mild, moderate, or severe hypertension. I'm not going to get into the numbers because I'm going to be focusing on the medications, their actions, and most importantly, side effects, the things that you need to know so that you or your family members need to know. So diuretics. Diuretics are basically medications that increase the excretion, as we call it, of salt and water. Patients with hypertension have a tendency to retain too much salt, and this salt, when it is in the arterial walls, make it become like stiff, like a lead pipe, more or less. Not that stiff, but it makes them stiffer. So by removing the salt from the arterial walls, you can make the arterial walls more flexible so that they can dilate and bring the blood pressure down. So these water pills increase the excretion of the sodium or the salt. Along with that, they also excrete other minerals like potassium, magnesium, and those are some of the things we need to be watching for. There are different kinds of water pills. They work on different segments of the kidney loop, and that's something which we really don't need to get into. But we have the loop diuretics like the Lasix or Furosemide, which most of you are familiar with. It acts in the loop of Henle. Then we have the thiazide diuretics like hydrochlorothiazide, which you have heard about. That works in the distal convoluted tubule. And then we have the potassium sparing diuretics like triamterene or aldactone, which works in the distal collection tube. So these are some of the locations of these medications, but basically they do the same thing. They increase the excretion of salt and water in the urine, thus reducing the salt in the body and especially in the blood vessels. So here are some of the medications. Furosemide, which you are quite familiar with. Torsemide is similar to the furosemide, and then we have bumetidine. So these are all diuretics which work in that loop and increase the salt excretion. On the other hand, we have the hydrochlorothiazide, which I mentioned to you, which is commonly used for hypertension, and that is working in the distal convoluted tube. Now let's talk about some of the side effects of these diuretics. As the diuretics increase the clearance of sodium and water in the urine, it also increases the clearance of the magnesium and also potassium. That's why people who are on big doses of Lasix or furosemide or bumetidine, they need to be taking potassium supplements. If you don't take these supplements, you're going to have muscle cramps and weakness. Similarly, these diuretics can also cause like ototoxicity. That means hearing problems can arise from the toxicity from these diuretics. So that's the first segment of our presentation. Next, here's a list of these drugs, which is, you can pause this and look at it. You may be on hydrochlorothiazide, which is a common one used especially in the early stages of hypertension. As the kidney function gets a little worse, you may have to switch over to like furosemide or torsemide, depending upon the condition. Some patients may have heart failure on top of hypertension, in which case you would try to avoid using hydrochlorothiazide and use furosemide or bumetidine or torsemide. Yeah, potassium sparing diuretics are used in certain conditions, but since it retains potassium, you don't want to use them in combination with other drugs in patients with kidney failure, because then it will suddenly increase the potassium level. That's something we need to keep in mind. Okay, let's move on to the second class of drugs which I mentioned to you, that is the beta blockers. You have heard about beta blockers like atenolol, metoprolol, low pressure, or labetalol, or nembivolol. So these are all beta blockers. What do the beta blockers do? But before we know what beta blockers do, let's study about what are these beta blockers. These are receptors located in the heart muscle, the beta 1 receptors. Then we have the beta 2 receptors, which are located in the smooth muscles in the lungs and blood vessels and bladder. And the beta 1 receptors are located in the heart, and they are located in the kidneys. When someone is given a beta blocker, basically it decreases the heart rate. Number 2, it decreases the force of contraction of the ventricle. If your heart is beating strongly and you give a beta blocker, one, the rate slows down, and the contraction also kind of gets a little sluggish. So that's the main function of the beta blocker. And the beta 2 blockers dilate the airways in the lungs. So that's a different issue. We are not going to be concerned about that. There's a beta 3 also, which acts on the fatty tissue and also on the bladder. But the main concern we are going to be focused would be beta blockers used for treating hypertension, which reduces the heart rate and brings down the blood pressure. And this is a picture showing it. What it does is it the adrenaline and noradrenaline that is brought on by the sympathetic stimulation. When you get excited, the body releases adrenaline. This is called the adrenaline rush. That sits on the heart muscle cells to increase the contractility and increase the heart rate. But by blocking these receptors, it decreases the heart rate and blood pressure. So that's the heart function. It also works on the blood vessels in the arms, legs, and that's decrease the resistance to the blood flow. The main side effects we need to be concerned about beta blockers, obviously, is because it slows the heart rate. It may slow the heart rate too much. Sometimes the heart rate may go from 80 to like 60, 50, 40. Some people may walk around with 35. So it has to be closely monitored by your primary care doctor and perhaps your cardiologist. And when it drops too slow, and if you're having symptoms, that is something that has to be addressed either by decreasing dose of medications or switching over to a different medication which doesn't slow the heart rate that much. Along the same lines of a heart reduction in heart rate, it can also block some of the heart impulses from going from the upper chambers of the heart to the lower chambers and causing a block. In rare cases, people may end up needing a pacemaker because if they need the beta blockers and if they're having these heart blocks interfering with their cardiac function, then they may end up getting a pacemaker. Again, because these beta blockers decrease the pumping action of the heart, they can make the heart failure symptoms worse. They can also cause bronchospasm because the beta 1s, as I said, they work in the heart muscle, but they can also work in patients with COPD in the lungs, causing constriction and making their breathing worse. They are also associated with some depression. Sexual dysfunction it is reported, but it's not very common, but it is occasionally reported because where people lose their sex drive, they can't get an erection. And when things like this happen, we may have to either reduce the dose or switch to a different drug. And along with that, they also have like sugar problems, especially if the person has diabetes and some changes in the potassium levels. So these are some of the side effects related to beta blockers. Next, we have all these different names. I'm going to just let you pause this and see which medication you're taking. They are called the non-selective beta blockers. That means they can act on beta 1 and beta 2 and alpha receptors also. And we have the selective beta blockers, which acts on only beta 1 receptors, primarily in the heart and kidneys, like these selective beta blockers, like the atenolol, metoprolol, bisoprolol, and all these work predominantly on the heart by reducing the heart rate and reducing the contractility and thus improving the blood pressure. These non-selective ones equally work well. Then we have a third kind known as beta blockers and alpha blockers. So it's a combination of beta blockers and alpha blockers. You probably have heard this labetalol or carvedilol. Carvedilol is used more often in patients with severe heart failure, but it is also equally good in controlling the blood pressure. Okay, let's move on to the A's and ARBs. You'll hear some of the names like Enalapril, lisinopril, monopril, or losartan, valsartan, telmisartan, or mycardis. So these are all the drugs that belong to this group. The ACE is angiotensin converting enzyme inhibitor, and ARBs are angiotensin receptor blocker drugs. What is happening in patients with high blood pressure is there's increased renin secretion by the kidney. This renin acts on the angiotensin in the lungs and converts that into angiotensin 1. This angiotensin 1 is converted into angiotensin 2, which is like a hormone or an enzyme, which is a very strong vasoconstrictor. That means it constricts the blood vessels. That leads to high blood pressure. So they cause vascular hypertrophy. They cause systemic vasoconstriction. They cause vasoconstriction throughout the body. And they also increase the blood volume, and they also retain salt and fluid. So this cycle is causing a continuous rise in blood pressure. So there are two levels where we can block this cycle. The first one is the ACE, the angiotensin converting enzyme. The angiotensin converting enzyme is the one which converts A1 to A2, and if you block here, we are not going to have this potent vasoconstrictor angiotensin 2, and thus reduce the blood pressure and peripheral vasoconstriction. On the other hand, we can block this angiotensin receptor. This angiotensin 2 works on certain receptors that are located in the blood vessels, which will make the artery constrict. But by blocking those receptors, the medication, even if it's there, it cannot be effective because it is not able to get inside the cell to constrict the blood vessels. So that is the mechanism by which ACE and ARBs work, and here is a different way of explaining. The kidneys produce renin, which acts upon angiotensinogen, which is like a precursor. It is produced by the liver and it is usually converted in the lungs to angiotensin 1, and the angiotensin 1 is converted into angiotensin 2 by the ACE inhibitor. By ACE enzyme, and that's where we use ACE inhibitors to reduce the blood pressure. And the next step is we prevent this angiotensin 2 from getting into the blood vessel cells by using this antagonist, which blocks the entry of this angiotensin 2. And what are some of the side effects? When we use an ACE inhibitor at this level, they also build up some extra chemicals known as bradykinin. And this bradykinin kind of irritates the airways and causes dry, hacking cough, which you have heard with the people taking ACE inhibitors like lisinopril, monopril, or enalapril. And that's one of the drawbacks of taking the ACE inhibitors, that is, they have dry cough. Okay, let's look at some of the names that you may be familiar with, like Vasotec, or Enalapril, Zestril, or Acupril, or Altes, or Mavic. These are all ACE inhibitors. The ARBs are like Adacan, Candesartan, or Irbesartan, Avapro, Losartan, or Benacor, or Telmisartan, Valsartan. So these are all medications which basically, as I said, they block the receptors at A2 level so that it doesn't act on the blood vessels and squeeze the blood vessels to increase the blood pressure. Let's look at the side effects. The side effects of one thing I should say is that side effects of all blood pressure medications is one, you need to be aware, because they dilate blood vessels, because they drop the blood pressure, people can get dizziness. People can feel like weak. They can have a woozy feeling. They can feel lightheaded, and that is common. And we may see them with most of the drugs, and they may last for 2 to 3 weeks. But if they persist, then you need to talk to your doctor about maybe reducing the dosage or trying a different medication altogether. So, as I said, all these ACE and ARBs, they all cause the same thing: dizziness, like fainting sensation, lightheadedness. And ACEs cause cough because of that bradykinin, which I talked to you about. We don't see that problem with ARBs. We don't have a cough with that. Again, low blood pressure, skin rashes, and some other complications that we need to be concerned about. However, ACE and ARBs should not be given to patients with renal artery stenosis because it's going to make things worse. But if your specialists suspect that you have renal artery stenosis, they can do a renal ultrasound or a CAT scan or a MRA to see if there is any evidence for renal artery stenosis. Okay, let's move on to the calcium channel blockers. As I told you from the beginning, that most of these drugs are designed to dilate these blood vessels because these blood vessels are chronically narrowed and constricted, causing the blood pressure to go up. And we use the renin-angiotensin mechanism to dilate these blood vessels. We also have the alpha blockers, which does the same thing. And the third group is the calcium channel blockers. When there is excess calcium in the blood vessels, the calcium moves inside the cell and makes the smooth muscles constrict. that leads to increased resistance to the blood flow, that increases the blood pressure. So the calcium channel blockers block the influx of calcium into the cells in these arterial linings where there are smooth muscle cells, and thus decrease the resistance, improve the lumen size, and improve the blood pressure. There are different kinds of calcium channel blockers, and you may be familiar with amlodipine. Most of you might have heard amlodipine, or cardizem, you have heard about this, or like verapamil or procardia. So these are the most commonly used drugs. They belong to different classes, but basically they all dilate blood vessels, except procardia, which can increase your heart rate very quickly because it dilates the blood vessels quickly. That's one thing you need to keep in mind. Anyway, when we are talking about these calcium channel blockers, as I said, they all dilate the blood vessels. The calcium channel blockers, just like beta blockers, also decrease the heart rate and decrease the heart function. With the exception of procardia, verapamil and cardizem both decrease the heart rate and decrease the contractility of the heart muscle. Again, they can also cause, just like beta blockers, they behave in terms of causing conduction disturbances, and also they have impaired glucose tolerance, which we also saw with beta blockers, and of course interaction with the digitalis, the medication used for control of heart rate or arrhythmias. Then it can also interfere with beta blockers because they are sort of doing a similar kind of work on the heart and on the blood vessels. So it just shows these are some of the things that we need to be aware of. And now we're going to move on to the alpha blockers. When our body gets stimulated, the body releases epinephrine and norepinephrine. Epinephrine is like a more pure alpha stimulant. That is, it stimulates the blood vessels. It wants to increase the blood pressure. It wants to increase the heart rate. It wants to prepare the body for a fight. And that's the role of epinephrine. Norepinephrine also does the same thing, and that is, it increases the blood pressure, increases the heart rate, and these are done through the actions through the alpha receptors located in the blood vessels. We talked about dilating the blood vessels using the different mechanisms, namely the ACE and also calcium channel blockers. Now we have a third mechanism that controls the blood vessel tone, and that is the alpha receptors that increase the vascular tone by constricting. And that's where the alpha receptor blockers come into play. Epinephrine and norepinephrine, they increase the blood pressure, they increase the constriction of these arteries, whereas the alpha blockers does the opposite, and that is they block these receptors and decrease the resistance and thus bring the blood pressure down. We have the alpha 1 receptors, which are located in the blood vessels, in the eyes, and also in the bladder retention. Whereas alpha 2 receptors, they work inside the brain and then send signals or block the epinephrine and norepinephrine signals reaching the target organs like the heart or the blood vessels. So predominantly we have two different kinds of medications, the alpha 1 which act on the peripheral arterial system, and alpha 2 which acts on the central nervous system, as it is called. Okay, and here are some of the drugs that are used in the category of alpha blockers. Like we might have heard prazosin or minipres, doxorubicin, and Caldura, then terazosin. Then the selective ones, we have tamsulosin, which is mainly used for prostate enlargement. Then silodosin, again, that's used for prostate. But importantly, we need to focus on prazosin, doxorubicin. They are very potent drugs because they can block these alpha signals going to the blood vessels and can significantly drop the blood pressure in a very short period of time. That's why we have what is known as the first dose effect. That is, when patients take the medicine for the first dose, take the first dose, they need to be observed in the medical under supervision to make sure that you're not dropping your blood pressure too quickly or too much. The dosages are listed here, and let's look at some of the side effects of these. These are all the these are all the different class of drugs which I have talked about, and their location of action, most commonly used drugs, and their main effects on the blood pressure by reducing the vascular resistance and by decreasing the heart rate. But most of them do so by reducing the vascular resistance. Anyway, so the alpha 1s constrict the blood vessel smooth muscles. Alpha 2, inhibition of norepinephrine release from the brain neural system. You have the central nervous system that is controlling the peripheral sympathetic system, and that's where it works in the brain. Then beta blockers and all these things, we have talked about this. And when we are talking about alpha blockers, they do vasodilatation, which I talked about. And I already talked about first dose effect. That's why they need to be very closely monitored. It can also cause, because it dilates the blood vessels so profoundly, it can cause like a drop in blood pressure when you stand up, and then cause weakness and dizziness. And this is known as the postural hypotension. So if you feel you're kind of feeling woozy when you get up suddenly, then that's a caution for you to, one, change the way you get up, you wiggle your feet before you get up, and number two, monitor your blood pressure while lying down and sitting and standing, and if it drops quite significantly, talk to your doctor and maybe adjust the dosages. Because they dilate the blood vessels and increase the vascular capacitance, they cause reflex tachycardia. The body thinks, oh, the blood pressure is going down, we need to increase the heart rate, we need to increase the contractility. And that's another reason because they dilate the blood vessels in the head, it can give headache. It also causes retrograde ejaculation. And some people may experience nasal congestion. These are related to the alpha blockers, whether they are peripherally acting on the arterioles in the body or in the brain. Now, if you look at alpha blockers, here is the list of all these drugs. Of course, this prazosin is also used in patients with heart failure in addition to hypertension. Doxorubicin is used for prostate enlargement and also for hypertension. And this carvedilol is used for heart failure and hypertension. Okay, some of the things we need to be concerned about is a class of drug called alpha beta blockers. They block the alpha channel in certain regions, they block the beta receptors in the heart and kidneys, and these are the combined drugs, the most important of which are labetalol and Coreg or carvedilol. If you are having heart failure, you are probably placed on this medication to treat heart failure and also control blood pressure, because they not only decrease the heart rate, decrease the contractility, they also dilate the blood vessels in the arms and legs that bring down the resistance against which a weak heart muscle has to pump. Okay, so ladies and gentlemen, in conclusion, I have covered all the cardiovascular drugs that are used for treatment of hypertension. So the next time you visit your doctor, what I would say is, before you visit, you put your medications on a spreadsheet. Put down the name of the medication, the dosage of the medication, the frequency of the medications, the mechanism of action, and the major side effects you need to be concerned about. So that whenever you get these symptoms, first you need to see if it's replicated on a repeated basis. Number two, talk to your primary doctor and see if it is just related to the body getting adjusted to your new medication they started, or is it something beyond that and something that has to be changed. And then when you are on 2-3 different medications, you get the so-called combination effects, which is unpredictable. That's why I think you have to be an educated consumer to monitor your blood pressure, because monitoring blood pressure is important. Blood pressure is a lifelong problem, and this is something we need to meticulously adjust. Just like when you are driving, we constantly adjusting our speed, we constantly adjusting our steering wheel. Same way, we have to monitor our blood pressure and medications under the supervision of your physician so that you can avoid any major complications that might necessitate a visit to the emergency room. So, ladies and gentlemen, thank you so much for watching this long presentation. But this is like a once in a lifetime. You need to watch this and go back and watch again anytime you have symptoms, because I have explained in detail how each one of these drugs work, where they work, and what they do, and what are their major side effects. I have hundreds of videos on heart education on our site, and please do subscribe to our YouTube channel. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. Thank you so much.